In this brief video, I will review the new release of the guidelines for the examination of the fetal nervous system. In particular, this first part will focus on the screening examination and indication for targeted neurosonography, whereas another video will focus on the second part, meaning targeted neurosonography. The main innovations versus the previous editions are listed here. We have acknowledged the fact that in some areas of the world there is screening for CNS abnormalities going on also earlier than 18 weeks, and we recommend scanning planes. We added a formal definition of neurosonography as level 2 examination for the suspicion of brain abnormalities, set a definite list of indications to neurosonography, and finally define the criteria on how to request and by whom fetal CNS MRI. The main issue, the first issue actually, for everybody involved in screening for CNS abnormalities during pregnancy is that they should be familiar with the dramatic changes which undergoes the fetal nervous system with advancing gestational age. These changes are shown here, and you see how the actual views of the fetal brain change dramatically, going from 12 weeks to 21 to 32 weeks of gestation, with evidence of the chord plexuses with the butterfly sign at 12 weeks, together with the prominent Sylvian aqueduct, which then shrinks afterwards. In the second trimester, the main landmark is represented by the cavum septi pellucidi and the lateral ventricle, with the atrial width to be measured, as we will see afterwards. And also you see that you can also have a look on the transthalamic view at the development and the opercularization of the insula, as you see here. What remains unchanged are the two recommended planes for carrying out the screening, which are actually the transventricular and transcerebellar planes. In particular, these two planes should be, that are shown here, should be complemented with the transthalamic plane only for the sake of the biometric measurements. On the transventricular plane, there are three issues that you should fulfill. The first one is that you should be able to visualize the cavum septi pellucidi in between the two frontal horns along the midline. The second issue is that distal lateral ventricle should be clearly seen, clearly visible, and we do know that the proximal one is shadowed by the parietal bone. And third, we should measure the atrial width according to the methodology shown in the next slide. The measurement is the same as recommended in the previous edition, with the position of the two calipers in to in, at the level of the glomus of the chord plexus of the lateral ventricle that you see here, and the image for carrying out these measurements should be magnified. The second view is the transcerebellar plane. On this view, you should assess the normal shape of the cerebellum, the rim of fluid in the posterior fossa, with the remnants of the Blake's pouch here on the midline. And also you should measure the transverse cerebellar diameter. As for the spine, when technically feasible, this is the optimal view, the ideal view to get. Longitudinal view of the spine with the two rails here and the overlying continuous contour of the skin on the top of that. This should be obtained in order to screen for open and closed spinal dystrophies. Some of you may know, the overwhelming majority of cases with open spina bifida will present with the cranial sign, the most relevant and constant of which is the so-called banana sign, which is due to the distortion of the cerebellum and the annulment of the cisterna magna, consistent with the Chiari malformation due to the leakage of fluid across the spinal defect. And these signs should be seen in virtually all cases of open spinal dystrophies. And now the new sections. The first one, as I was telling you before, we do recognize that a screening ultrasound for CNS abnormalities can be done also earlier than 18 weeks. And if you do so, the same two planes should be achieved for screening purposes, namely the transventricular and transcerebellar planes. And here you see one such image showing the transventricular plane and the transcerebellar plane taken at 16 weeks of pregnancy. Another new point regards the indication to fetal neurosonography, which goes beyond the suspicion or detection of central nervous system or spinal malformation at mid-trimester scan, or the scan carried out earlier for the nuchal translucency at the end of the first trimester. There's also a family history of inheritable CNS or spinal malformation in order to reassure the parents, hopefully, that there is no such another recurrence of the same lesion. And the same applies for previous pregnancy complicated by fetal CNS malformation. Then we have a fetus with congenital heart disease, because it is well known that there is an increased risk of congenital and acquired lesions in the brain of fetuses with congenital heart disease. And the same is true for monochorionic pairs. Also suspected or confirmed congenital viral, but also protozoan intrauterine infections such as CMV or toxoplasmosis or rubella, flu with rubella or Zika, more relevant during the last years. Exposure to teratogens known to affect neurogenesis. And finally, chromosomal microarray findings of unknown significance. And the reason why we included this last item is that sometimes, in very rare occasions, neurosonomy may uncover subtle but clinically relevant anomalies escaping recognition as screening ultrasound, and thus supporting the BOWS as non-BOWS but pathogenetic. That we set the indication for fetal brain MRI. In particular, we have underscored that the MRI should be requested by the expert performing the targeted neurosonography examination, whereas it is not appropriate to request MRI based only on suspicion of brain abnormality raised in the screening ultrasound. So the level 2 neurosonographic examination is the key point to decide whether it is the case or not to request a fetal brain MRI with a definite query, I would say. So in conclusion, with this new release of the guidelines for CNS assessment during pregnancy, we have confirmed the two reference planes for second trimester scan and screening as being the transventricular and the transcerebellar planes, together with longitudinal plane of the spine. The same two cranial planes are recommended for early screening, less than 18 weeks of pregnancy, in those areas and countries where this is done. We have set definite criteria, a table of indications for targeted neurosonography, and as defined at the same time this as the level 2 examination for the fetal brain. The publication is available on our website, and you can copy this link and download these new guidelines for free. And I also remind you that part 2 will be dealt with in another short video.